my name is Macy Frederick. I'm a physical therapy assistant located in Birmingham, Alabama, that specializes in treating vestibular disorders through physical therapy. Most of the time when my patients come in, they have no idea exactly what their vestibular system is. Most of the time we walk around day to day not knowing what the system is or that we even have one until we have something wrong with it and it's causing symptoms. This presentation was made to go over just a general, basic overview of the vestibular system's function and anatomy. So where is your vestibular system located? The answer is in your inner ear, behind your temporal bone. We do have a structure in each ear. I like to tell my patients that these structures are tiny but mighty. They are about the size of a dime, but they can cause a lot of problems if not working properly. What is my vestibular system responsible for? It's responsible for assessing head and body movement and position in space. It generates a code representing this information and sends it to your brain and your spinal cord, aka your central nervous system. You have semicircular canals, anterior, lateral, and posterior canal. The purpose of these canals is to detect rotational movements. When the rotational movement occurs, it causes fluid in the canals to move, causing the hair cells to bend. Bending of the hair cells stimulates the vestibular nerve. As you can tell in my picture on the right, the guy is standing up straight, no movement. So his crystals are all in line and his hair cells are all in line. But whenever he goes to bend over, you see the crystals moving and the hair moving. With that movement, it detects that you're moving, sends that code to your vestibular system, up your nerve, to your brain, to let your brain know where you are in space and what movement you're performing. This is a close-up picture of the crystals. The crystals make you sensitive to gravity and help you keep your balance. Normally, a jelly-like membrane in your inner ear keeps the crystals where they belong. Crystals being out of place can cause dizziness and imbalance, which is also referred to as BPPV. The two otolithic organs are the utricle and the saccule. The purpose of the otolithic organs is to detect linear movement of the head. For example, the otolithic organs are activated when you walk forward and backward or when you jump up and down. The otolithic organs are able to respond to linear head movements in the following way. When a linear movement occurs, it causes the fluid in the otolithic organs to move, but crystals in the otolithic organs to lag behind. The lagging behind of the crystals causes hair cells in the otolithic organs to bend. The bending of the hair cells stimulates the cranial nerve. So the cranial nerve that it is stimulating is your vestibular cochlear nerve. Vestibulocochlear nerve. So it is your cochlear nerve for hearing and your vestibular nerve combined. The purpose of the vestibular nerve is to transmit balance-related information from the semicircular canals and the otolithic organs to the brain and spinal cord. All these resources were found on vestibular.org/A Patient's Guide to the Vestibular System. I highly recommend going to this website for any more resources on what is going on with your specific condition or your specific questions. Also, helpful tips for daily living. I'm now going to go over the basics of a vestibular dysfunction. So this is not going to go deep into the particulars of each vestibular dysfunction. There's a lot of different ones out there, but I wanted to go over just the general basics. So, dizziness caused by vestibular disorders. The body maintains balance with sensory information from 3 systems: your vision, proprioception, and your vestibular system. So, definitions of symptoms. Knowing the definitions before you go into your doctor's appointment or meet with your therapist to accurately describe what you are feeling will help them understand and be able to narrow down what is going on. So the first definition is dizziness. It's a sensation of lightheadedness, faintness, or unsteadiness. Dizziness does not involve a rotational component. Vertigo. The perception of movement or whirling, either of the self or surrounding objects. Disequilibrium. Unsteadiness, imbalance, or loss of equilibrium, often accompanied by disorientation. Spatial disorientation. A sensation of not knowing where one's body is in relation to the vertical and horizontal planes. Specific vestibular system problems. Vestibular dysfunction is most commonly caused by head injury, aging, and viral infection. Other illnesses, as well as genetic and environmental factors, may also cause or contribute to vestibular disorders. For more detailed information about these specific vestibular system problems, please visit www.vestibular.org. And then these are where my resources have came from. If you have any questions, please comment below and I'll try to get to as many as I can. Thank you very much.